When President Obama gave his marching orders on health care to congressional Democrats, the message seemed clear: come up with a way to lower health care costs and provide coverage for the millions of Americans without insurance. But with just days to go before a self-imposed Christmas deadline, it appears the Senate health care bill will not include a government-run health care program or a provision allowing some people to buy in early to Medicare. So if those key elements are out, what's in the bill? To answer that question and a lot more, we're joined by David Mark, senior editor for Politico. Good morning.
Good morning. Good to be with you.
So the public option out, early buy into Medicare out. What is left?
Probably the most important provisions that are still left, at least from a Democratic point of view, are ones that would force insurance companies to cover everybody. They would not be able to deny claims to people with pre-existing conditions. In other words, if you're already sick, they can't say, oh, we're not going to cover you. Also, another big provision left would force everybody to carry health insurance, just like car insurance. And that's a very controversial provision.
As the Senate bill stands right now, how does it compare to the House bill?
The House bill is much more liberal, shall we say. It does contain a public option, not as broad and robust as some would like, but it does include a form of a government-backed health care program. The Senate provision, as we were just discussing, has no such mandate in it.
DNC Chairman Howard Dean said on Wednesday in regards to the Senate provision, no one will think this is health care reform. This is not even insurance reform. Now, should the Senate table this and revisit it at another time instead of rushing in for this Christmas deadline?
There are a lot of different opinions on this. Some, like former Governor Dean, think that the best thing they can do essentially is start over. One idea he had was to get into the reconciliation process, which is a long way of saying it's Senate maneuvering for not needing 60 votes to break a filibuster, only needing 51. For a lot of technical reasons, it's very difficult to get legislation passed that way, but that is kind of a backup option. Others are saying, let's just forget the whole thing and start fresh in the new year.
Do you think that this Christmas deadline has hurt the process?
It does seem like by setting a hard and fast deadline, if the senators do not meet that self-imposed deadline, they're coming up short. So it probably has not really helped things a whole lot. At the same time, Republicans are going to be voting against this, etc., uniformly. So the Democrats probably did do themselves a favor in some way by forcing the issue and not letting it drag on well into the new year.
Now, there's been some talk in political circles that this is not about necessarily health care reform anymore. This is more about the 2010 elections. What do you think?
I think the Democrats, particularly the Obama administration, really want to get this issue off the table. Survey after survey shows that this is not a top priority for people. Rather, the economy is. People are deeply concerned about the job situation, about being able to pay their bills, their mortgages. And I think the Obama team and a lot of members of Congress, frankly, want to just get done with this and look toward the economic scene in 2010.
And to remind everyone, once they do get done with this in the Senate, they still have to reconcile it with the House version, right?
That's right. That's no small thing. There are significant differences between the House version and what the Senate is discussing right now. That could potentially take 2 or 3 months, depending on how the negotiations go.
All right, so we've got a ways to go. David Mark from Politico. David, thanks so much.
My pleasure. Thank you.